Good afternoon, everyone. Welcome to the June virtual road trip. And I see folks getting on quickly. I'm Pam Brandon with AGE-u-cate, and here I have with me Lydia Cristobal. And we're excited to have you all join us. She has a lot of valuable information to share. So as you are getting on, I'm gonna just tell you, for those of you who are new to our virtual road trip, which we are going into, this is our 18th month. We started it in January of last year. So for those of you who are new, welcome. A little bit about AGE-u-cate Training Institute. We develop and deliver effective and affordable caregiver education and meaningful and life enrichment programs. So caregiver education for professionals and families. Our flagship program is Dementia Live, which is our dementia simulation experience and empathy training. We have Compassionate Touch, which is our skilled touch and specialized communication program, specifically meant to help those who in dementia and reduce stress reactions. Then we have our life engagement programs, our newest innovative reading program called Reading to Connect, our flashback reminiscence program, and Ageless Grace, which is our brain and body fitness program. Our very latest initiative that we undertook during COVID was our Reveal Aging initiative, which is really to support the workforce retention strategies of organizations. And these are quality of life training, 1 hour device enabled micro-learning content delivery of a suite of quality of life and quality of care training. So we have a lot going on at AGE-u-cate, and we encourage you to take a look at our website if you want to learn more about what we do. But I don't want to talk about me, because we have a great speaker here today that I'm very excited to share with you, Dr. Lydia Cristobal. She is a healthcare executive who specializes in post-acute and geriatric care. She earned her undergraduate and graduate degrees in nursing administration from New York University and doctorate of nursing practice from Yale University. She is a licensed nursing home administrator, board certified in gerontology, and an advanced nursing executive practice. She's also a veteran of Operation Enduring Freedom and continues to serve in the U.S. Army Reserve as a major in the Nurse Corps at Picatinny, is that pronounced correctly? Arsenal in New Jersey. I was telling Lydia when we were getting on the call earlier, I don't know how you had time to, with all you do, to be on here, but you're an amazing person with so many fingers in so many different areas. We really appreciate you taking the time. So Lydia is an administrator at a community in Hudson County, New Jersey, and is the founder and CEO of Lydia Alicia Consulting. So welcome, Lydia, and we are very excited to hear about what you have to share in strategies for organizational stewardship. So I am going to mute myself and let you take it over from here. So welcome, Lydia.
Thank you very much, Pam, for this opportunity, and I'm excited to be here with you. So just a little bit of my background. I actually started as a licensed practical nurse, and I pretty much grew up in long-term care. So my first job, as soon as I received my license as an LPN, was in the nursing home. And obviously, during that time, as a naive and new nurse, I started working. Actually, my very first job, I was only 20 years old. So I'm really, really fairly new at that time. And I just navigated my way around that. And that was also the time when the the US Army recruited me. And that was a time when they have really good marketing strategies to attract me. They were sending me pamphlets and an Asian nurse in Army uniform said, hey, this could be you, using high-tech equipment in the background. And, oh, you can keep your full-time job and you can join the Army as a part-time soldier. And so that kind of interested me to join the Army as well. And I figured, well, since I'm adventurous, why not? I'll just go in and do it. And then at that time, when I enlisted in the Army, I went to the boot camp, and there you go. I started as a specialist, which is an E4. And I also learned a lot from being in the Army, and I'm still serving right now after 21 years. I love what I do in the Army, and as a matter of fact, I wouldn't consider myself the way that I am now as a leader had I not experienced all of those wonderful experiential learning, both in the civilian side and in the military side. So I want to give that perspective or in background so that you can understand where I'm coming from and all the things that I've learned through the years. So it is in those experiences that I had various experiential learning from different managers and leaders from several organizations. And we all have experience being in an organization where there are toxic leaders. I remember me crying when I had these supervisors who were screaming at me, yelling at me at that, and the only thing I can do is cry. But those are the types of experience that I learned that if I get to be a leader, if I get to be in that position, will I be doing the same thing when I get to that? And those indirect mentorship from leaders is what made me better as a person. And so I promised myself that I will learn from this, be stronger, and be the leader that I want to be. So why did I choose organizational stewardship as my topic today? Because I highly believe that investing in our workforce generates the desired outcomes. Because stewardship is a caretaker approach. How do we take care of our workforce? We as leaders must enforce standards and values that are in the best interest of the organization. So let's go back. Let's reflect on lessons learned from COVID-19. It's been a crazy year, right? And we learned so much. And even at this very moment, we are still have to change our policies for the 60th time because what we're now learning more about the virus. But let's go back. What happened when the pandemic happened, right? I can tell you a story way back in March, when we were still in the cusp of almost getting to the lockdown. But we know that there were cases in February at that time, but we're just following what the CDC tells us. And so even if we knew that this is an airborne or a droplet virus, maybe we started asking ourselves, well, maybe we should be wearing a mask. And people are scared. We were all scared, right? We all were in that situation where we were scared. And so there are staff, because they want to protect themselves and their families, they started wearing masks. But here's the problem. The organization who was following the mandate that we don't have to have a mask at that time, right? They were actually telling the staff not to wear a mask because by doing so will scare people, the other people in the healthcare setting. And to me, I find it really strange that they would actually counsel the staff not to wear a mask because it would scare other people. So what did that end up? It resulted in losing trust in the organization. What did that give our staff? It damaged the physical and psychological safety. And that's a sad truth, right? And then eventually that was when, oh, now, by the way, now we have to wear a mask. So, but the damage has already been done. So these are the lessons learned that we received from COVID-19. But with that negativity, we also learned some positive things from the pandemic. We allowed some risks that resulted in nursing innovation. I mean, we've seen in social media where nurses or other healthcare personnel use garbage bags as PPE because we ran out of PPE, right? Or some hospitals, they extended IV lines to limit going into the patient's room. So there are many things that we just have to think and allow the staff to figure out how are we going to do this without really exposing ourselves to the virus. At the same time, all these things brought us together because what did we realize? We only have each other to rely on. It strengthened our teamwork to take care of each other. We protected each other because we realized we do not want to lose them to COVID. But unfortunately, we also did. And so that in a way damaged us, but it also made us stronger. So then how do we define healthy work environments? Through physical and psychological safety. So let's define healthy work environment. So a healthy work environment is a place of physical, mental, and social well-being for optimal health and safety. So for the physical and psychological safety, we need to create a psychologically safe and mindful environment where employees are trained to look for and report small problems that could lead to big ones. A culture of safety and resilience imparts a sense of psychological safety, respect, and empowerment to voice concerns without fear of retaliation. No one is penalized if asked for help or admit a mistake, right? So then we need to ask this question. Are we really scanning the environment daily to ensure safety for our staff and patients? Were there any concerns brought in by staff that makes them feel unsafe? So just like the situation that I said earlier, right? If they feel that they need to wear a mask, we should allow them. It's kind of too late now, late in the game, right? But we learn from it so that in the future, if something similar happens, we know that next time we will try our best to make them feel safe. So then another question that we need to ask, what is the organization's process to ensure that any employee is free to bring it to someone else's attention? Are employees comfortable in reporting? Because if they feel that whatever they say, or if they question something that will result in retaliation, then they're not going to speak up. They're not going to contribute. So we need to establish a strong culture of physical and psychological safety that will enable the staff to provide innovative ideas for solutions and contribute to the organization's performance improvement. I'll give you an example because we like stories, right? So in one instance, I had a director of nursing who disagrees with me during staff meeting. The whole purpose of having a staff meeting is really to talk about our operations. What else can we do to improve? What are the things that we need to know about and discuss as part of our quality improvement initiative, right? And so since I was trying to build a culture of trust within the staff, some of my staff are comfortable in telling the actual situation, the truth, what they have observed. So for instance, oh, well, the reason that we couldn't communicate well is because the book that we need to look at is not in the nurse's station. It's always on someone else's office. And when that unit secretary told me about that, the director of nursing thereafter was upset and actually talked to the unit secretary that she shouldn't have said that because it's throwing someone else off out of the bus. And I was like, but the intent is really to throw anyone off the bus, but rather this is exactly what is happening in the situation. And so we can't fake of what is already happening. What we can only do is move forward and fix it. So it's a difference between the way I actually perceive what is meant by just culture, as opposed to calling out someone, and it's not really throwing them off the bus. So there's a fine line between the intent of the situation, but what is my lessons learned there? I need to educate my director of nursing that it's about perception. And so on my next director of nursing, I made sure that during her onboarding that this is how I envision a culture of trust. This is how I envision organizational stewardship, because providing psychological safety in a healthy working environment is crucial to attain the status of being a high reliability organization. So now that I have a new director of nursing and I was able to correct all those mistakes, that I should have said that from the very beginning, right? So that they understood what is expected of them. So now that we know about physical and psychological safety, so then how do we discuss various communication strategies, leadership and team building through a culture of stewardship? So as leaders, we make or break the culture of stewardship, right? Professionalism. Do we practice it all the time? I mean, it's easy to say, but very difficult to do. Sometimes we always have to look at ourselves in the mirror and see, is this how we really want to portray ourselves to our subordinates? And accountability. Do we really show accountability for what we do? Do we apologize for making a mistake? And it's okay, we're humans. We can make errors, right? Or do we blame other people because we don't want to show that, oh, we're perfect? Do our actions show we care about our staff and patients? Do we tolerate bad behavior? Because tolerating bad behavior destroys the morale of high performers. I consider myself a high performer, and I can tell you many, many stories about how it really disappoints me when an organization tolerates bad behavior. Because really, most people leave because of their managers. Studies have shown that it's really not the pay, but being a part of an organization. So we always have to examine, because we as leaders, we're the one who will cultivate this culture of stewardship. And we always have to reflect. We always have to reflect every day. What are the things that we can do to make things better? We cannot allow ourselves to always continue doing the task and not really think about organizational stewardship. They need us. They need us to take care of them. We need to practice servant leadership. And so if we want to establish a culture of trust, we need to show and be transparent that we care about our staff. They see us, because I always see as leaders, they look at us every day. For me, I consider myself every day in my workday that I am constantly on stage and people are watching. They are watching our every move. And from then, then they can determine, are we really a good leader that they can trust or not, right? And so then let's talk about transformational leadership. Motivating employees to transcend their own self-interest to improve performance through organizational learning and innovation. And transformational leadership is essential to facilitate psychological safety. So it all is connected together, right? Because leaders model the ideal behavior. I can tell you, when I was a nurse manager of an organization, I was surprised. There was no culture of accountability. And everyone is just kind of doing their own thing. And it was a disaster, pretty much. But as a leader, I told myself, you know what, this is a project. I want to show that I can practice transformational leadership by turning this around. So I pretty much worked a lot of hours during that 1 year to make sure that I am investing all my hours, I'm investing everything to change this bad culture that I inherited. And I started it by modeling that behavior. In other words, for example, I cannot tell my employees to come on time if I myself do not come on time, right? So I have to show them that I am the first one to arrive in the scene. I am the first one to ensure that the environment is safe, and that whatever it is that I expect of them, I have to model that behavior so that they can see. Because I don't want to be hypocritical by telling them that they should do something and I myself am not practicing it. It's just not right. So in other words, the result of that, after 1 year, my boss actually thanked me that, oh my God, what you have done, Lydia, has a tremendous impact, because he saw the difference in how the environment was before until after a year that I have shown the transformation that I have left in that organization before I left. As a matter of fact, before, people were blaming each other, right? And everyone's coming in late. But then thereafter, instead of blaming people, they helped each other. What used to be a complaint session during the huddle became to be a telling good news stories, because I empowered them to make decisions. I allowed them to I allowed them to have risks, that if you come to me with a problem, you better offer possible solutions. Because what happens is, even if I already know the answer to the problem, I would make them feel that it was their idea, it was their solution. And because they came up with the solution, I am actually going to name that new project through them, because it's, let's say Mary came up with this wonderful solution, and so it's now Mary's project. And so it makes them proud that, oh yeah, I thought of this great idea. So it's a matter of giving them empowerment, a sense of pride that they were the ones who provided that solution. And it's the same story. How many, and I'm sure there are many in this call that are in long-term care. How many times have we seen, especially when I was a staff nurse in a nursing home, how many times have we seen that on an everyday basis, when we feed patients in a dining room, no managers are there? Oh, but when the state surveyors are in the building doing the annual survey, or for whatever reason, all of a sudden we see an administrator or a charge nurse or an MDS coordinator starting to pass out trays and start feeding patients. We've seen that all the time. And that's why when I told myself, like, oh my God, I can't believe that they're doing this. they're only doing this because the Department of Health is here and the surveyors are here. But yet, as soon as these surveyors exited, it's back to the same routine. We're off to fend for ourselves. So this is how the culture of trust is either destroyed or established, right? So right now, as an administrator in my organization, I pretty much tell my staff, you always have to do the right thing all the time, every time. We cannot do shortcuts, right? Don't get me wrong, there are some situations that we just have to prioritize what we need to do. But on a regular day, we shouldn't be doing extra stuff or only doing some stuff when the surveyors are here. Because I always tell my staff, listen, every day is survey day. You always do the right thing because we have to do the right thing all the time. We're doing this for our patients because we care about our patients. And so we shouldn't be doing something special just because the surveyors are here. And as a matter of fact, if they're practicing it every day, then it comes like second nature to them because there's nothing new and there's nothing to be worried about when the surveyors are here. And I'll tell you another story as well. When I came to another organization where they're not prepared for an annual survey and I know I have to fix it. And so when I did a mock survey, I pretty much I'm giving my own facility an L or an L scope severity that is just really bad, right? And the staff hated me, that they thought that I'm actually here to fight them instead of helping them. And so I had this idea that I told them, hate me now, thank me later. We are open for our survey, and we can't just sit around and just figure it out. We have to correct this now. And there's a time frame. And so it's either we correct this or we all sink together. And so eventually they finally got the gist of that hate me now, thank me later, because we worked hard at it. And I am a firm believer that I do not want to give them the fish. I want to show you how to get the fish. We will get there. I can only be there an X amount of time to help out, but I want everyone to be independent to make sure that we are doing the right thing every day. And so after we receive the deficiency-free survey, then they can thank me after, right? So it's just a matter of allowing them to trust me that, listen, the house is on fire. We need to do something about it and we have to act about it now. And I know it's hard to trust because I'm a new person, I'm a new administrator in that facility, but at some point I have to hold their hand and show that we are all doing this together as a team. Because a culture of trust empowers staff to take the big lead, right? And so we must figure out that if the house is on fire, we need to put out the fire immediately because there is no time. There are some situations that we can just take our time because we have plenty of that to work on. But we have to communicate and we have to be transparent that this is our situation. What can we do to change it, right? And the same thing for us leaders. We need to train, as administrator, we need to train our managers that it's important that we are honest with each other because we have to have this culture of trust. Because we are humans and we tend to make mistakes. And so I tell my director of nursing that, listen, it's okay if you make a mistake. Just tell me, we'll fix it. And so pretty much if we educate our managers to be like that, they will do the same thing to our staff. And so by establishing that culture of trust, we're also providing that just culture. That if anyone makes a mistake, it's okay. We're not blaming the person who made a mistake, but rather what processes that are in place that allowed this situation to happen. Because if we provide the psychological safety to our staff, that once they speak up and say, oh my God, I just realized I did this and I made a mistake, we should fix it. If they are comfortable in saying that to us, that they know there are no retaliation, then that will help our quality improvement process, right? Because they already rang the bell that brought it to our attention to fix it. But if we do not provide that psychological safety to them, then what does that turn into? Then that means they're just going to shut up because they're afraid they're going to lose their jobs or be disciplined. And then what happens? We'll wait until the surveyors find out that something wrong is happening. We cannot allow that. We have no time for that, right? So how then do we apply strategies in providing performance evaluations that will enhance employee engagement and productivity? I'll tell you one example of a really, really good nurse. I was an LPN at that time in a nursing home. And there's this RN who's the typical old school, old tradition nursing, right? The time when you still have time to provide back rubs to our patients. She's one of those RNs that I would entrust my own parents for her to take care of my parents because she's that good. Unfortunately, she's not good in admin stuff, paperwork, documentation. But me as an LPN, and I was promoted as a unit manager, I said, you know what, we'll switch. I'll do the admin stuff, you do your thing, right? And it worked well. Unfortunately, when I left the organization, I heard thereafter that this particular nurse was fired because she told the truth to the surveyors that when she was giving med-pass, the medication was there, and so the medication was not given. And to me, it was heartbreaking because she has been in that organization for a really long time, and she has contributed to the organization that made its status in providing great care. But the problem is, because there's this high turnover in nursing homes, they fail to recognize all the good things that she has done for one event. Because she believes in telling the truth, she should not be fired just because she said the truth to the surveyors. Was she educated anyway? So this is just one of the many stories that is so sad that we lose good employees because of bad management. And this is one of the stories that CMS realized that it's not just the employees. It's the organization's responsibility to educate the staff to make sure they are competent and validated to do their job. And in this case, she was not educated on what is the appropriate response to give the surveyors. So the time now that the CMS has recognized, now they're providing an actual specific F-tag citation to those facilities who provides that they need to provide the training to make sure that each employee is competent and validated in every task that they do. Oh, but wait, how many nursing homes have we seen that we have this in-service educator who does not really provide the education, but merely collecting signatures just to show that an education was provided? You see that all the time. And guess what? It's still happening now as we speak. Because, oh, I got other things to do. But that defeats what the CMS wanted for each state to implement, that each organization really must provide the actual education to ensure competency for employees. So then how do we evaluate employees? Do we do self-evaluations? So I'll tell you a really bad story. And up to this very day, I still feel bad whenever I think about that. I was a newly clinical director of a SNF. And all of a sudden, one of the educators told me, oh, hey, Lydia, you need to do this evaluation for this employee. Meanwhile, I just got the job. I was only there for 3 months. And here I am asked to do an evaluation of 5 employees. So what do? Well, I pretty much just went along and provided the basic evaluation. And then that nurse, who's an RN at that time, she said, why are you giving me just satisfactory? I said, can you give me examples of what you have done? She provided some examples, but the mere fact that she was really disappointed. She was disappointed that she was viewed as just a mediocre nurse, when in her mind, she has gone above and beyond. But again, it's that problem of high turnover, right? And it's very difficult to evaluate someone when we don't really know them. So then, how do we do our annual evaluations? What I learned from the Army is that we do some one-on-one sessions quarterly. And for me, if I use that in the civilian world, then it provides an update for each employee to think about where they stand, so that every time you meet with them, even in an informal session quarterly, then at the end of the year, then they would have had 3 opportunities at least to improve, so that by the end of the year, we can tell them like, hey, you met your target, or you went above and beyond, and then they both will be happy, right? And so we have to think about what we expect each employee to function, instead of just doing a mere task of doing an evaluation for the sake of doing it. And also, do the evaluations we do tolerate bad behavior? In other words, do we give satisfactory scores to those employees who's pretty much really is not up to par with what they have to do? I'll give you another example. I consider myself as a high performer, right? And I am new to an organization in Texas, and the big organization changed their evaluation as to the generic evaluations into a goal-oriented objective evaluation. In other words, at the beginning of the year, you are provided specific goals that each employee needs to do. And once you meet that goal, that's where the score will say if you deserve a raise or not, right? So from the very beginning, I pretty much understood what my goals are, and then defined that if I meet this specific metric, that means I will be rewarded as exceptional or outstanding. That if I meet all that goals, my whole evaluation will be exceptional, right? And so I made that initiative to my boss, and I asked, oh, okay, how am I doing? Oh, you're doing great, you're doing great. But then after that, at the end of the year, she gave me like satisfactory, and I'm like, oh, wait a minute. All this time that I am meeting with you, you said I'm doing great. And yet at the very end, I'm not exceptional. I just showed you the metrics, and I did above and beyond. And I said, I don't understand why you come up with this final decision. And after the fact, I realized it's because there's a cap to the raises, that they can only approve X amount of employees to be outstanding for a raise. And I guess I'm not I'm not in that clique. Make a long story short, I'm no longer in that organization, right? So I am one of those examples that people leave because of their managers, right? Not because of the pay or anything else. So we need to examine. We cannot expect our employees to excel if we don't tell them exactly what that definition is, right? We need to examine our own biases as well. And for those organizations who still has that generic performance evaluations, which to me, it's not really reflective of the employees' performance. So we really need to tailor the way we do our evaluations to recognize really good employees. And so we need to make sure that we need to have quarterly reviews or meetings to give employees a chance to correct themselves so that they know where they stand, right? Why don't we allow the staff to define what the reward system should be? Maybe you should have a staff meeting. As a matter of fact, one of the meetings that I had with the staff, I said, okay, what kind of reward does everyone want, right? And they said just coming to work gives them a reward. I'm like, what? But in their mind, that's how they defined it. But then when we come together and I have to explain to them that no, our definition of going above and beyond is X amount of tasks or projects, right? They have to do specific projects or contribute to the quality improvement so that if they meet those, then that's going to be in their evaluation. So how do we design future innovations and opportunities post-pandemic after implementing organizational stewardship strategies? So opportunities to invest in organizational stewardship, we have to start with our managers. We have to invest in them. We have to educate them what we expect of them. So if there are administrators on this call, we are the leaders, right, of that long-term care facility. How do we envision what good organizational stewardship is? What kind of culture do we want to establish? And we need to train our managers. Because if we don't invest in them, then nothing else is going to happen. And then the same question is going to happen. And here are administrators questioning, oh, we can't recruit people or we lose employees. We will continue to lose employees if they're not happy with us because we don't recognize the great things that they do. So by rewarding them for recognizing their great work, and it cannot be generic. If we can provide patient-centered care, why can we not provide staff-centered care? Right? Because organizational stewardship is that we're taking care of them, servant leadership. And so isn't it common that for administrators or for DONs, as a matter of fact, it's a constant for most organizations in long-term care, there's a high degree of turnovers because as a matter of fact, it became a joke to us now administrators when we meet, like, oh, we've known this organization that they just keep firing administrators left and right. And so because it's a small community, especially here in New Jersey, that it became a game that we bid on, oh, that administrator is only gonna last 6 months. Oh, nah, 3 months should be good. And it's sad, right? It is very sad that these organizations, instead of supporting their administrators, empower them, they just fire them because it's easy to fire them and just get a new one. But what we don't recognize is a high turnover leaders affects the staff as well, right? And what would the staff feel whenever they are in that situation? Oh, here's a new administrator. Oh, here's a new director of nursing. They're excited. They're new. They want us to do this new project. It's just a beginning, because after that, then what? There's a new administrator going to come, and then therefore a new project. So nothing stays. So we need to prevent that. We need to make sure that we provide the good support for administrators and director of nursing and all the managers. So how do you redesign reward system through innovation that is cost effective? We need to ask employees themselves. They will tell us. I mean, I'll tell you an example. One of my director of nursing, she said that, I want to reward my staff by giving her a meal card. The staff thanks her, but she's a vegetarian and she doesn't even want to eat the cafeteria. So what is the point, right? Here you are thinking that rewarding them with a meal ticket will make them happy, but they bring their own lunch anyway, so it's irrelevant. So it doesn't mean anything. I know it's as simple as that, but we need to think about those things. We need to tailor the reward system, but what is meaningful for them. So we need to provide opportunities and projects for staff that they can engage in and be proud of. I'll tell you one of the innovative ways that we are doing in my organization, and I will actually share that screen to you. So last year, we actually presented our interprofessional collaborative music therapy program as adjuvant to pain control to reduce pharmacological interventions. And this was presented internationally during the 31st International Nursing Research Congress, supposedly in Dubai, but the pandemic happened, so there you go. But pretty much we used music therapy, right? And the staff was engaged in our evidence-based music project, evidence-based practice project for music therapy. And now our poster is here and we are proud of it, right? So these are just one of the things that we can do, provide projects for the staff to do. Here's another thing that we're going to present this year. Now we're interprofessional horticultural therapy to augment performance and activities of daily living and quality of life. So we actually named our horticultural therapy into our garden club. And these are actual our photos that we did. Our patients were happy in doing horticultural therapy that provided really good results. Better quality of life and improvement in activities of daily living. And we're very happy. We're a fun comical team, right? And this is our actual patient. She was so proud of her plant, and it's cost effective because we just used disposable cups. So that's one of the things that that you can ask the staff to do. That's evidence-based, and one of the things that we can share, right? And a lot of the nurses who have a bachelor's degree have they understand what evidence-based practice is. So organizations realize the opportunities leveraging the use of technology for efficient care, right? During the pandemic, how many times have you seen organizations in hospital system, as a matter of fact, when we have to use technology to deliver care? As a matter of fact, it has proved to be more cost effective using technology, that now they're keeping that same process. So what about for long-term care? What are opportunities that we can use to leverage that? Well, guess what? Maybe you can ask the staff, how can they engage in it? What other innovative things that they can contribute to the organization? So in summary, we need to have a robust organizational stewardship to be a highly reliable organization that provides the best outcomes. I hope this webinar have been helpful to the audience, and I'm ready to take any questions. Are there any questions from the group?
Well, I will say, I will jump in here and say I took many notes. Thank you, Lydia. That was very, very informative. And I love the term high reliability organization. That says so much. And what you tied into that with servant leadership, a transparency, an acceptance of being able to make mistakes and just being transparent about it. Learning, innovation, keeping employees educated, so important. Of course, we're passionate about that, and that leads to empowered employees and empowered organizations. So I certainly took many notes, and I will remember high reliability organization, because I think whether you have a nursing home or whatever organization you have, as leaders, if you're not committed to that and serving the people that you are there to serve, and that includes your employees, that you're missing a huge opportunity to grow a healthy organization. So thank you. That's what I took out of it. And I don't know if others want to take out, maybe chat in what you brought, what rung a bell from Lydia's many, many good things that she had to share. And I love that you were so transparent about how difficult it is to work with regulations, state regulations. And I mean, that's just the environment that you are in. And you have to work through and around that and with the state in order to be successful.
Yeah, and I think that it's very important that we are consistent in what we do, so that the staff understands that there's a momentum that we need to keep going.
Yeah, absolutely, absolutely. Well, if there are no questions, I'm going to thank you again, Lydia. It was extremely encouraging, and lots of good thoughts that I think we will all take back to our own organizations to make improvements. And that's what this is all about, is to make people change. And so I appreciate all the time that you put into delivering such a great presentation. So for participants, we are taking a break from our regular virtual road trip series that we have had. So we're taking a break just for July and August. We're going to make it fun. We're going to bring some new creative life engagement activities that you can deliver online, that you can deliver in person, because I know many of us are getting ready to go out in the world again. And wow, and we are all ready for that, so ready. So we want to share a little bit about what some of our partners are doing. I love the idea, Lydia, of the horticulture and music, and that it just took creativity, and look at what the results are. So we want to be able to engage with our network and get ideas from you as we get on these calls. So look in just a few weeks, we'll be sharing what we have planned for that, and we're going to keep you on edge. But we'll be doing some ageless grace. I'll just tell you that. But it will include just all kinds of fun things that we can take back. And again, preparing ourselves for when we're in person again. But knowing that organizations have also found that they are reaching people online, and that is not going to go away. So that, again, is a good thing. It's something we learned from COVID that we didn't even know we were going to learn. And I think, Lydia, can't you say, from all the struggles we had, all the challenges, if we don't look at this and say, I'm grateful for what we've learned, we've missed the boat, because I think we've all become, whether it's leadership or whatever profession we're in, we've all learned tremendous amount from this that'll help us grow and be better.
As a matter of fact, that's a very good point. I actually made sure that we had a debriefing with our staff after the pandemic. And it is through their comments and feedback from that debriefing that we learn, like, oh, things that we didn't realize that we can improve on, because we know for sure that another pandemic is going to happen again. It's not if, but when. And so we have to be prepared for that.
Yeah, absolutely. We've been told that, and man, we're going to go into it a whole lot smarter in a whole lot more ways than we ever knew. So with that, I will thank everyone again for being here, for allowing Lydia to share with us some valuable insights. And so please have a great week, have a great weekend, look for our information, and most of all, be grateful, because things are looking better. Are the challenges over? No. We'll all have challenges, and they move into different challenges, but we have much to be grateful for. So thank you again, Lydia, and all of you out there for joining us today.
Thanks, everyone. Thank you, Pam, for this opportunity. Have a great day.
Bye-bye.
Bye.